Welcome to A Better Way, a sustainable approach to dentistry. I am Dr. Reed Winnick, founder of Dentistry for Health New York.
Hi, I'm Tammy Kolschmidt, dental hygienist, clinical thermographer, and body talk practitioner. And tonight we have with us Dr. Niloo Dardashti.
Welcome.
Yes, she's a certified psychologist, a coach, and she's also certified as a holistic mental health practitioner. And I can tell you that before having Niloo on air, we were in the back just kind of getting to know each other, and she has a very different approach with her work and with her treatments.
Right. There aren't many psychologists who are also trained to be life coaches and who apply 2 different, or maybe even 3 different disciplines, as we'll learn, into really help her clients or her patients reach a higher level of achievement or whatever other avenue they're looking to build in their life. So why don't you start off by telling us, how did you decide to be a psychologist, and what made you branch out and to offer your patients more diversity?
Well, I've always been fascinated by human behavior, sort of what moves us to do the things that we do, think the way we think, feel the way we feel. And I was very fortunate to get my doctorate at LIU, which is comprised of faculty who have all different orientations. So I got training in psychodynamic, cognitive behavioral, dialectical behavioral, and couples therapy.
Mm-hmm. So that was just part of your curriculum?
Yeah, basically. And I had faculty who were of all of those different theoretical orientations. So it was great because I got to learn from multiple orientations rather than just one.
So,
I was going to say, how did the holistic certification come in? What was your crossing point for that?
Yeah, I always knew that I wanted to combine them. I just have always looked at people as a whole, mind, body, spirit. And so I knew that, my fascination with psychology extends into other matters of the soul, matters of, neurochemistry and biochemistry. And so after I was done with my doctorate, I got certified by the East-West School of Herbology. And then I did a bunch of various trainings. I got trained with Julia Ross in targeted amino acid therapy. So I integrate that into my practice for people who want an alternative to medication. And of course, that doesn't mean that people, there's never a need for medication. Yeah. But this stuff is often very, very good at helping relieve symptoms that people come to see me for.
So then what you're saying is that you're not just sitting there and talking to patients and listening to them, you have a rapport going, but you also look at their overall nutritional state, because if, let's say they have a gut issue, we know that most of the serotonin is produced in the gut, and that can also affect the mind, so you are working on their digestion and...
Absolutely.
That's great.
Yeah.
And have you been doing this for a while? Is it...
Yeah, I've been doing it for a few years. There's definitely a food-mood connection.
Right.
There's definitely, insofar as nutritional imbalances and vitamin mineral deficiencies can contribute to a host of problems that we see.
I wanted to know, how do you find that a certain patient has a food-mood connection? I mean, is it every patient that comes in that you do the amino acids with, or is there some testing you do for that?
Some people just come to me for that. Some people come just for therapy or coaching, and some people come for both. Or I will have somebody come to me for the coaching therapy piece, and we'll realize that there is certainly a biochemical component involved.
Right.
So we'll do maybe some testing, or I will. I generally ask a lot of questions to get at what I think is necessary as far as amino acids go, or any nutraceutical use for that matter. And so, and of course, diet is a big part of it. If somebody's eating pizza and pasta every day for all of their meals, they're more likely to contribute. That's more likely to contribute to their anxiety, especially anxiety with the blood sugar crashes and such.
Yes. So we work with the mouth, right? So we come from the point of view of always incorporating nutrition into what we do. And what we've found is a lot of breakdown, if it's not from infection, it's actually from lack of protein. And we find that a lot of the, I would guess say, people who are the most unhealthy in terms of the mouth are not getting enough protein in their diet. So from your point of view, can you tell us how the protein connection is for the mind?
It's absolutely crucial, absolutely crucial. Protein consists of amino acids, which are the precursors to the neurotransmitters that we need to feel good. Serotonin and dopamine being two of the main ones. But protein is such an overlooked piece of the diet, often I find, and it really is upsetting to see that, because it's the basis.
It's simple to fix, actually.
Right. But it's not just protein, it's the quality of the protein.
Yes.
I mean,
quality of the
just
protein.
eating frankfurters isn't really going to help you.
No, yeah.
You know, and there is good meat and there's bad meat, and there's meat that has pesticides and antibiotics. So
and hormones.
So that all has to be balanced, and patients need to be really educated about what is a good meat to eat, and also what would be considered healthy fish to eat.
Yeah,
right?
That's true.
Can you, I'm just curious, as when a patient comes in to see you, I know you probably have some kind of framework with you from your training. Can you give us some idea of what makes you a little different than the average psychotherapist in terms of what you're doing?
Well, just want to say that there are a lot of wonderful psychotherapists out there that are doing their best, and it's a hard thing to help people with chronic issues. I generally integrate certainly my training, the different things that I've been trained in. I also have a very solution-oriented approach. I really like to have a sort of a structure and an agenda to what we're doing. So it's not just this open-ended, long-winded sort of thing where we don't really know where we're going, which often happens a lot of the time, unfortunately. Even when people are doing their best. So first thing I really try to do is understand what is going on. What are the person's goals? Why do they think they haven't gotten to their goals? What are the barriers? What has worked and what hasn't worked? And come up with some real sort of concrete, realistic things to make it happen. And also to understand, does the person want things to change? Right. Is there a function to keeping things the way they are? Because sometimes there is. And that's one thing to identify as well in the beginning.
Right. So let's say that you have a client who finds themselves, they have a hard time getting along with their workmates, right? And they go from place to place, and what they're really doing is bringing themselves to each place. It's not really the place, it's themselves that are not really changing. So how would you look at that person? How would they what would be your ways to start those goals and to get them motivated, or not really motivated, but just on the right direction, to have them first want to look at themselves and then go to the next step?
That's really important, is looking at themselves, because so much of the time people are focused on what everybody else is doing.
Right, but how do you tap into that? How do you tap into telling a person, well, we have to start looking at yourself? What questions do you ask them?
Well, if somebody's coming to me, I will always say to them, look, all we can do in here is look at your role. We can't change that person. Right. We can only work on you. So if you're not willing to look at you, there's no point in coming in here. Right. You know, I'm not going to sit here with you while you spend the hour just talking about what everybody else is doing, because it's not going to help you. Right. And I'm supposed to be doing whatever's in your best interest. And that means that sometimes I challenge you. And I don't coddle you, and I don't collude with you to let things continue the way they've been going, which clearly hasn't been working. There certainly may be people in your life that certainly everybody plays a role in every interaction, in every interpersonal relationship, and they very well may be very, very annoying in some way, and pissing you off in all sorts of other ways. But we've got to talk about, what can you do? What have you brought to the table, and what can you do to sort of ameliorate the situation that you're in?
So do you find that you're spending a lot of time getting someone to open up? Is it what are the tricks to the trade? How do you I don't know.
How do you break the barriers?
How do you break the ice? How do you get them started?
Well, it depends. It depends on the person. If somebody comes in and they're very, very defensive about, very threatened by looking at their role, it's going to be harder, right? I mean, and you've got to move with somebody's ability to do such a thing, to look at their role. And to really ask questions like, so what did you do in this situation? What did you do in this situation? What was sort of the common theme that you noticed came up? What have you heard as far as feedback goes from people in your life? Why do you think that is?
Right.
Well, if you had to if you had to pretend you were that person for a moment, what do you think they would say? No, I know, but what do you think they would say? What do you think they would say? And then take that and just kind of look at it for what it's worth.
Right.
Slowly even.
Right.
Some people are willing to move faster than other people in that respect.
Right. And I know I know you for a while, and you have a different, almost like 3 different training backgrounds. One in cognitive thinking and some other training, and I know NLP. Can you elaborate how they combine together and how you use each one, and what the benefit is to your clients by having so many different tools in your toolbox that you can draw upon?
Sure. Well, insofar as psychodynamic theory goes, I think it's certainly very important to understand how your past affects your present. Staying with that as far past as you can go.
As a child?
Yeah.
Okay.
Yep.
Staying with that and just kind of focusing on it forever doesn't help you to move forward, right? But understanding and awareness is a sort of prerequisite for change. So having that insight into how the past has affected the present can only help. It can only help. And then when we look at something like cognitive behavioral therapy, which is really based on the notion that you have thoughts that affect your feelings, which create behaviors, which result in behaviors, usually avoidance or escape.
Right.
So what are these automatic thoughts? How are they affecting your feelings? Sometimes anxiety, sometimes depression, stress.
But also, I think beliefs come in there also.
Yeah.
Yes,
Belief systems.
absolutely. So if you think of these automatic thoughts, they're usually based on core beliefs.
Right.
Belief systems that somehow we've integrated internally into our internal worlds. And so looking at those beliefs, knowing where they came from, speaking of the past, and working on, not just identifying them, but really questioning them. And really looking at whether there's another way. Is there another way to think about this? How is thinking about this the way I've been thinking about it helpful to me in my goals that I want to achieve? And then kind of starting to think about the idea of challenging some of these thoughts based on cognitive behavioral therapy. People lots of the time have what's called faulty thinking. So we're not really thinking in what's the most effective way for us.
What would be an example of
faulty thinking?
I can't do this.
Ooh.
See, if we could just simplify that for a minute, because everything that you've been saying resonates with me as a hygienist trying to get a patient to create a new habit, hydroflossing, or maybe just changing something in their daily routine for their home care.
Right.
And that's exactly what we come up against.
Right. It's interesting because they want to change.
They
know it's better.
They know.
But they don't do it.
Yeah.
So what are your hints for us?
Yeah. Well, if you're thinking about that from a thought perspective, you might ask them, if they're resistant to it, what are your thoughts about it? If they say something like, oh, it's too much, I can't do it.
Can't fit it in.
Yeah, I mean, there's what many of us engage in, which is called catastrophic thinking. And that catastrophic thinking usually is what leads to avoidance, right?
What do you mean by catastrophic?
Catastrophic thinking is when we kind of jump to this sort of, oh, I can't do it, it's too much, I don't have time, blah, blah, blah. Or oh, I'm going to mess up. If I, when I have to talk in front of everybody today, I'm going to mess up. That is kind of like, that expectation sets you up,
right?
Yes? Yeah. So, insofar as what you're talking about and how that's concerned, I would ask them, what are their thoughts about it? Does it, if the thought is it takes too much time, well, I would compare it to other things that they do make time for.
Oh, that's a good one.
You know what
Yeah.
I mean?
Yeah, that's good.
And this is something that is necessary, right? It's necessary
It's absolutely
for their health.
necessary.
You know,
These are people who don't feel sick, but I guarantee you they're sick. The infection in their mouth is it's prevalent, and it can lead to many other things. So, you know, they understand that, but again, I don't know if it's going back to belief systems or if it's someone telling them something that they have to do. I mean, there's many perspectives that a person can have.
yeah, we were talking about that earlier. I think sometimes, you know, there's a resistance when someone tells you you have to do this.
Oh, totally.
And to integrate something, internalize it as sort of this is something I have to do, it has control over me. Rather than I have control over this. I can schedule time for this when I find when it's the right time for me. Every night at 9:30 it works for me.
Yeah.
You know, do you know what I mean?
Yes.
So scheduling it is certainly very important too. It's making the actual.
And I understand what you're saying, but sometimes it's kind of hard because we play the doctor.
Yeah.
And the doctor is used to teaching and educating and saying, well, you need to do this because you want to get from point A to point B. It's very logical. So you need to do this. So if let's say we have that part of the population that can't be told you need to do something, what would be a better way to present that to them? Or if someone's sitting out in the audience tonight and you know they know that they shouldn't smoke, or they know they shouldn't eat sugar, or they know they should be exercising, but they know it, but they don't find the time to do it. It's not priority for
But that's different because there could be different barriers for different people. What you asked before about people who, one of the barriers being, I don't like someone telling me what to do or feeling like I need to do it.
Right.
Well, my suggestion for that is asking them, what do you think? What are your options here?
Right.
You know, and kind of putting it on them, putting the onus on them. So what do you think is going to happen? Because yes, you're trying to describe to them this is an investment, you know, for your health, right? You're trying to sell them on something. But you're saying that they're internalizing it almost like you're telling them they have to do something.
Right.
If they're internalizing it that way, you know,
is it almost rebellious?
Could be. You know, no way of knowing without talking to someone, actually. But a good idea is to always ask questions. What do you think is the barrier for you?
Okay.
Is it that you feel like you need to do it? Is it the time? Because those automatic thoughts that usually the behavior is based on can usually be challenged, especially if it's not functional.
Okay, so can we just kind of recap some of these barriers for behavior? So far, we said that someone may feel like it's a control thing. Someone's telling them that they need to do something, so therefore they don't do it. The second barrier could be time management. Another barrier, it could be the self-care, not understanding, you know, how to take care of themselves. Is there another barrier? What would another barrier be?
Well, it's just also not important to them. As their esteem is low, they don't care how they look.
Okay.
You know, I don't know if someone has bad breath, do they not know that they have bad breath? I mean, you know, if their mouth is dirty, you look in the mirror. They don't care? You know, I'm wondering about that. It's because it's kind of obvious. We're sitting here. We all have clean teeth. Even the cameraman has clean teeth. You know. So what makes us so special that we can see what's on our teeth? Why are other people just missing it?
Yeah, where is the disconnect with self-care? Like, what are some other barriers?
Well, I think we're talking about a couple things here. So self-care can come down to feelings of worthiness. Am I worthy of taking time out for myself? Am I worthy of taking care of myself, of really taking the time that it takes to take care of myself? But not knowing that you have schmutz in your mouth, I mean, that's
a whole nother consciousness.
That seems to me like it also becomes part of a whole picture of awareness of oneself in general. Maybe even social awareness.
They could be just so much up in their head that they're not thinking about the the outer parts of themselves.
Yeah, I mean, it's one thing to feel good about yourself and not care so much how you look. It's another thing to not take care of yourself in the way that is hygienic. And then, of course, you know, when we look better, we feel better. When we feel better, we look better. I mean, it's a chicken and egg thing. And when we come down to the idea of balance, you know, yeah, it would seem to be extreme to be focusing constantly on how we look, but it would also be extreme to not be aware that we have stuff in our teeth, or to think that it doesn't affect our health, or it doesn't affect our social interactions when my breath smells. Do you know what I mean? So that can certainly be a barrier, of course.
What about the type of person who is like a people pleaser? And so they're so concerned about pleasing their spouse or their children. They're just pleasing everyone around them, so that they end up running out of time for themselves, and they have total self-neglect because of the pleasing. The one thing, though, I can say is that type of person, sometimes it works in our benefit, because they'll try to please us, you know, for their next appointment. So in a way that does work. But what can you say, and I think that's mostly women, but where's the disconnect there with trying to please everyone on the outside, and then the self gets neglected?
I always say that people pleasing is beneficial in that very moment, possibly, but in the long run, it never works.
It never works.
It never works.
Because you'll pay the price eventually.
Yes, and so will they.
Yeah.
Because as it happens, you'll maybe end up resenting somebody because you're so concerned with their needs and totally putting yours aside. And B, it just doesn't make for a equal, balanced relationship. And then, of course, you lose out on taking care of yourself and your needs, which are inherently important when it comes to health and self-care and maintenance and so on.
Right.
So I think that for people who are watching this and find themselves being one of those people who tends to think about the other person before they think about themselves, is to really is to ask themselves why that is. And how often that is, because it's adaptive to think about other people. It's compassionate. It's good to be empathic. It's good to think about the other person and be considerate. But at an extreme, that leaves you drained.
Yeah. There's no more benefit. The benefit is gone.
Right. You know, you mentioned equal, balanced relationships. Can you kind of give us an idea on what you would describe as, in your world, what would be the ideal equal balance relationship in terms of communication and, you know, just all the other aspects that go into a relationship?
Yeah, I mean, I often tell people to separate their needs from their wants, from their deal breakers.
What would be an example of the difference between needs and wants?
I need him to help out with such and such at home.
That's a big one.
Yeah.
Right.
Or I want him to
spend more time with me.
Yeah, I mean,
I want more attention.
And yeah, I mean, and that may end up being a need if there's a lack of connection between two people.
Is the difference between a need and a want just the way it's expressed to the other person? Like, is it different to say it's like, like, I need you to help me, or please, I want you to help me with this? I mean, does that come off? Do they have two different meanings?
I think so, because, you know, I had somebody once who had trouble, you know, who couldn't really differentiate between needing their partner to help around the house with certain chores and wanting their partner to fix a bath for them. I mean, that sounds like a want, right? Fixing a bath, doing extras like that, nice things, gestures, versus sharing chores at home, which is really a need when you have a family and you're trying to take care of multiple things at once. So it really comes down to communicating, identifying what your needs are, what your wants are, and finding ways to feel okay with expressing your needs. And even validating the other person in the meantime. I know you're super busy. I know you're doing A, B, and C. And it would really mean a lot to me if we could talk about how to also, you know, get these things done. I need your help with such and such.
Mm-hmm. And deal breaker? How does one establish what a deal breaker is?
I mean, deal breakers tend to be more part of the picture when you're dating someone.
Okay.
Right? When you're trying to decide whether someone's a suitable long-term partner.
Okay.
And you're trying to decide whether this thing they do or don't do that you've communicated with them about is not being addressed is a deal breaker.
Right.
Do you know
because
what I mean?
for the other person, it just may be not something they can give.
Yes.
Or do.
That's exactly right.
Okay. So then you'll know where your compromises are.
Mm-hmm.
All right.
I guess as you go along in a relationship, more and more compromises come up.
That's right.
Right.
Yeah. You know, something to be said about long-term relationships. I mean, you may know this person for 20 years, but they really, there's an endless abyss to getting to know someone. Even if you think that you know your partner oh so well, there's so many ways to discover a little bit more things about them that you may be surprised by.
Right.
But that takes time.
Right.
Mm-hmm.
And it takes a willingness, a want to journey into the deeper parts of who they are.
Absolutely
Right.
right. And to take risks.
Risks, yeah.
Mm-hmm.
Yep.
In communicating, if you're fearing that the person won't respond the way that you hope they'll respond.
Yeah.
That's partially a barrier for a lot of people in communicating their needs.
You know, I think we should continue this conversation next week. I will have Dr. Dardashti back. I think she's brings a lot of great insight into what you can get in terms of building a better relationship. I know she's going to talk about the well-known book and movie series called Twilight, and she's writing a documentary about that, on people relate to that series. And she's going to give us some tips on how you can improve your own life and achieve more than what you're achieving right now. Can you give us your information on how they can reach you if they want to speak to you more or get some...
Sure. My personal website is www.cbttherapistnyc.com.
And I'm Dr. Reed Winnick from Dentistry for Health, New York. You can always reach us at 212-973-9425.
And please email us more questions, more show topics at reid, R-E-I-D, at dfhny.com.
Or Tammy at dfhny.com.
He's always trying to push the work back on me.
Well, you have a great night. We'll see you next week.
Thank you.
Bye-bye.